Today we're talking a little bit more about whether a patient has hammer claw or mallet toes. And when we're talking about these, it's really important to differentiate between them and how they're looking so that we can get a better idea as to what treatment may be appropriate for them. When we're talking about a hammer toe, we're usually seeing sort of flexion of that proximal interphalangeal joint and extension of that distal interphalangeal joint. For our claw toes, each joint's going to be, in flexion, and for our mallet toes, it's typically just that distal interphalangeal joint that's going to be hitting straight down into the ground there. Now, irrespective of these, it's really about how reducible they are as to how effective treatment's going to be. When they're more reducible, they're typically going to be, better off, responding to some of our treatments. Now, of course, other things are going to come into play here, and there could be deviations potentially due to a plantar plate tear. There could be corns due to underlying osteophytes off of the joints. There could be callus due to maybe rubbing on the shoes or on the apex. There could be wounds and further callus there, and all of these are quite concerning because they're going to potentially cause pain, deformity, wounds. When we've got wounds that are not responding to our care, infection and further concerns as well. So really having an effective treatment plan as soon as we're noticing these concerns come up is really important. Typically our patients will be coming through and saying that they're getting pain when they're in shoes or on extended walking, and they'll often come through just with sandals or thongs because that's most comfortable because there is no rubbing. Our x-rays and ultrasounds are really important here to give us a good diagnostic understanding of what we're looking at. And on our x-rays, the lateral is going to really show up that there's a toe sitting above all the others there. There may be some osteophytes around the joints or off the joints on our dorsal plantar or lateral oblique x-ray views. On our ultrasounds, there could or could not be a plantar plate tear or attenuation, or that's the stretching of the plantar plate, which may mean that that toe's deviating, into the medial or lateral, and being aware of those sort of things as being contributors to this deformity is of, paramount importance. Now, when we're wanting to do an assessment, a really easy assessment is just to do our Lachman Dorsal Drawer, and that's going to be pulling up that, potentially second or third toe. And if that's painful, that's going to be more positive for a plantar plate tear. And particularly if you're then pushing down onto where that plantar plate is at the, second or third metatarsophalangeal joints, for instance, then that's going to be, quite positive for a plantar plate as well. Now, not always will there be pain, and it may be just that there's pain over the top. That quite commonly I have patients come see me with just pain over the top, and I'm able to produce some pain there due to a really chronic plantar plate. Palpate, see where your pain is, make sure it's in the right area, see how reducible it is, and that's going to give you a really good indicator of what you're looking at and how effectively treatment may be able to be utilised before it's too late there as well. If you're liking this video and some of the others you may have already seen, hit the subscribe button, have a look at some of those other videos, and we'll see you in the next session. Cheers.